Weapons of mass destruction, and missiles are on the Lord's band, and pointed at every nation. Time gets shorter. Crates of guns and ammo from country to country. They bring to the people.
I had a discussion over this past weekend about the lockdown, whether it was warranted or not. Most of the people I talked to said we have to listen to the experts and do what they say. What they don't realize is that the experts in the beginning of this knew as much about this virus as I did. It's a new strain. Although it was wise to listen to the initial advice of the experts who dealt with similar types of viruses, the overreach of the government is not the science. Okay? The statistics we had 2 months ago are far, far, far different than what we have now. The only data we had was what was coming out of China. So the only way to get a scientific model of what's to come, we had to use the data available and put it through simulations and in a computer, and it would give us the results. I've been watching this virus since the beginning. I saw the way the Chinese government screwed the pooch and lied all the way through. The numbers were getting so big that they couldn't hide it anymore, and people were reporting on this, and it was leaking all over the place, so they just couldn't hide it anymore. My girlfriend lives about 735 miles away from Wuhan. Hubei, which is, if you don't know, China has provinces. They're like their states. Hubei is the province of Wuhan. They had 68,128 cases with 4,512 deaths. That's a 6.62% death rate. Sichuan, which is where my girlfriend lives, in Chengdu, had 561 cases with only 3 deaths. That's a 0.53% death rate. So why was the number in Hubei so much different than the one in Sichuan? Well, it could be because the reporting wasn't being done like it should be. I mean, realistically, in Sichuan to only have 561 cases and 3 deaths, I don't know. That could be bad reporting. But that's the numbers I checked today. That's today's numbers. Well, it could be because the reporting is not being done like it should be. Or maybe it's something a little more sinister, like the Hubei government, the same people who are arresting people for reporting and holding community dinners for weeks after they knew about the initial infections. The way they built these big temporary warehouses and just put people inside, whether they thought they had COVID or not, ultimately infecting those individuals also, the numbers just don't add up. The point is, when we first started talking about sheltering in place, we went by these numbers to predict how bad it would be in the United States. My problem with all that is that when they make these models, just like the ones for climate change, call them the shadow government, the deep state, globalists, whatever you want to call them, they always take the worst case scenario. And then they use that as the fact, when in reality, it's never as bad. COVID-19 is the same, because they only use the data from those countries that had bad outcomes, like Italy and Spain and China, and then base all of their advice off of these models. Well, now that the United States is involved and we're doing some real testing and getting real results, we can start making better models. But for some reason, there are people out there, governors, government people, who wish to stick to the original model and keep things shut down. Why is that? I don't understand. Right now, in many places in this country, Americans can't even go out to walk in a park or have a dinner with families. They can't get knee replacements. They can't even get married at this point, which is affecting my life big time. If they complain in public, there's been a couple of people who have been arrested already. The whims of our political leaders are now unquestioned law. Dissent has been banned, and the ban is being enforced by the willing stooges of our media, who have finally stopped pretending that they like you. They don't. They hate you. I mean, what country is this? It's a country in lockdown. And mass quarantine, so they keep telling us, is the only way to save lives. But the problem is there's no scientific record of this. None. We're currently living in the most extensive social experiment ever done in history. Trillions of dollars and millions of people have been crushed purely on the guess that it would save us from the coronavirus. 8 U.S. states have not issued statewide shelter-in-place orders for their citizens. Arkansas, Iowa, Nebraska, North Dakota, Oklahoma, South Dakota, and Wyoming, and Utah. The question is, have these states suffered any more for not locking down? And the answer is no. They haven't, at least not yet. Currently, all 8 states are below the national average of coronavirus cases and death per capita. They haven't been immune to the virus, but they definitely have not been hit harder than any of the other states. Now, of course, Seattle, Los Angeles, New York, obviously they have big Chinese populations. So there's more of a chance of the virus getting in there. Plus, they're big cities, lots of close contact. Whereas North Dakota, South Dakota, there's miles and miles of empty space. So California is the first state to shut down in a televised statement by the Los Angeles mayor. He bragged. His city was under his absolute control, and for that reason, the coronavirus would not spread there. That's what he said. And anyone who disobeyed him would be hunted down. I'll let you listen to this with your own 2 ears.
This has really been marvelously embraced by 99.9% of people. We see it in the traffic data, we see it in the cell phone data, but we're going to hunt down that last 0.1% and say, you got to get inside, you got to cut it out, and you got to distance.
Hunt down the last 0.1%. Hunt down the last 0.1%. That's what he said. There was a couple of physicians from California. One's named Dr. Daniel Erickson, and he has a partner named Dr. Artin Mashi. They own an urgent care in Bakersfield, California. And they put out a 15, 20 minute review on the numbers that they came up with. And they were just asking the question of whether this is warranted or not. So the first one is from the numbers for California that they came up with.
So if we look at California, these numbers are from yesterday. We have 33,865 COVID cases out of a total of 280,900 total tested. That's 12% of Californians were positive for COVID. So as you guys know, the initial models were woefully inaccurate. They predicted millions of cases of death, not of not of prevalence or incidence, but death. That is not materializing. What is materializing in the state of California is 12% positives. Well, if we have 39.5 million people. If we just take a basic calculation and extrapolate that out, that equates to about 4.7 million cases throughout the state of California, which means this thing is widespread. That's the good news. We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. 0.03 chance of dying from COVID in the state of California.
Does that necessitate sheltering in place? I don't know. These are serious people who have done serious work for decades. They've done this for a living. They're trained doctors. So here's your experts. Now, I'm not trying to buck the system here and say that all these other doctors are wrong. I'm just trying to give you another different side of it. You know what I mean? You hear both sides of the story. What's so incredible about this is that so many politicians, the ones who are enforcing the lockdowns, don't seem at all interested about hearing this. Instead, they're just ready to bully forward as nothing has changed. The San Francisco area just announced it'll be extending its lockdown until the end of May. What is the scientific justification for doing that? There isn't any. They didn't tell us anything because there isn't any. Flatten the curve. And we did that. But it's likely not because of the lockdown. The virus just isn't nearly as deadly as we thought it was. But it turned out not to be. Hospitals were never overrun, outside of a tiny few of hotspots. They never came close to even being overrun, at least not from an influx of infected patients. Instead, something else happened. In fact, the opposite happened. Thanks to the lockdowns, hospitals began to collapse. Why? From a lack of patients. Politicians who couldn't pass the 9th grade biology test decided that practicing physicians should not be allowed to calculate the risk of transmitting the disease themselves. They're not qualified like they are. So these politicians banned so-called non-essential procedures, many of which are in fact pretty essential. The result of this policy in many hospitals is that entire floors are being mothballed and doctors and nurses are being furloughed in the middle of a pandemic. Doctors and nurses are getting laid off. So it's weakening our healthcare system. Again, I go back to episode 3, talking about the healthcare. Here you go. Here's the big setup for it right there. So how long do we have to live with these lockdowns? Well, earlier this month, Dr. Fauci, whom we are apparently required by law to respect, no matter what he says, suggested that we may never be allowed to resume normal life. And I'll let you listen to that.
If back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. If you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there.
That might not ever happen. That might not ever happen. Well, This is the same Dr. Fauci that was asked about the coronavirus, and he said we should stop handshakes. You know, the ancient gesture of handshaking. We should stop that. But then a week later, he comes out and tells somebody on Snapchat that having random sex with some stranger off Tinder is okay. Well, you know, that was his advice. Other experts on the television warned us about that full-blown lockdowns may be necessary until a vaccine or an effective treatment is found. What they did mention is that scientists have never produced a single approved vaccine or antiviral drug for any coronavirus whatsoever. So this could be a while. And that thought seemed to please frequent television guests, like Zeke Emanuel. I don't know if you don't know who Zeke Emanuel is, look him up.
Realistically, COVID-19 will be here for the next 18 months or more. We will not be able to return to normalcy until we find a vaccine or effective medications. Is all that economic pain worth trying to stop COVID-19? The truth is, we have no choice.
Oh, the truth is we have no choice. But here's a handy little guide for you about Zeke Emanuel. For those of you who just watch a lot of television and don't pay attention, this is a guy who lies constantly. So if he starts a sentence with "the truth is," you should probably be on your guard. And he ends the sentence with "we have no choice," you should be terrified. And in fact, it's wrong. We've always had a choice. Other countries made different choices than ours. In fact, they're not waiting for a vaccine to reopen their societies. Why would we do that? There's no precedent for doing that as a scientific matter, for example. We spent millions of dollars and more than a decade trying to find a vaccine for SARS. Science never has developed one. It's a shame, but we didn't halt life in the United States in response. We didn't. In fact, you may not even remember that any of that happened. The striking thing is that the science has not changed much since then. Unfortunately, American politics has. And that's the difference. So I want to go through a little bit more of the doctors, because I forgot to put the numbers in for New York that they came up with also, which was pretty interesting.
So I want to look at New York State. They've been in the news a lot, right? And their numbers are critical. Let's go over their numbers. Cases of COVID as of yesterday, 256,272 cases in New York State. Not New York City, New York, the entire state. They did a total of 649,325 tests. That's 39% of New Yorkers tested positive for COVID-19. That's their ratios. This is public data online. You can all look it up.
39% of people who were tested.
39% of the people were tested.
39% of New York State.
Right.
39% of New York State is there's 20 million people there would be close to 4 million.
Which is likely, they likely have 7.5 million cases
So I
in New
just want
York.
to make that clarification. It's
Yeah.
not 39% of every New Yorker, it's every New Yorker who's been tested.
Right, so we extrapolate
Okay.
data.
I just want to make that.
We extrapolate data, we test people, and then we extrapolate for the entire community based on the numbers. The initial models were so inaccurate, they're not even...
But in those initial models, a lot of them are based off if we did no social distancing.
Right.
Is that correct? So is it really fair to say, obviously they're not as bad as they were because those were based on alternative scenarios?
And some of them were based on social distancing and still predicted hundreds of thousands of deaths, which has been inaccurate. So in New York, the ones they tested, they found 39% positive. So if that's indicative, and they tested 649,000 people, that's a massive test. That's accurate data, 39%. So if they tested the whole state, would we indeed have 7.5 million cases? We don't know. We will never test the entire state. So we extrapolate out. We use the data we have because it's the most accurate we have versus a predictive model that have been nowhere in the ballpark of accurate. So how many deaths do they have? 19,410 out of 19 million people, which is a 0.1% chance of dying from COVID in the state of New York. And they have a 92% recovery rate. If you are indeed diagnosed with COVID-19, 92% of you will recover. So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death. And the reason I'm making that point is because we're going to compare this to flu and say, is this significantly different from influenza A and B? And if not, why has our response been what it is?
There it is. There it is. Why am I sitting at home? At this point, we need to start reopening things. But Governor Cuomo just thinks that this is the deadliest thing ever. He keeps touting this as a deadly, deadly virus. Not really. It's about as deadly as the flu. It might spread faster than the flu and spread easier than the flu, but it's about as deadly as the flu. So, what are we doing here? Well, I don't know. I'll keep an eye on it. We'll see. See what's going on. This is Jimmy Gann. See you next time.
Nuclear warheads, the weapons of mass destruction, and missiles are on the Lord's band, and pointed at every nation.